I should probably introduce myself. I'm Lee Ritchie, third vice president of the local Council of Women, and it's my pleasure to introduce our speaker for this evening. In recent months, Bloomington has been experiencing some significant changes in health care delivery. Not unlike other communities, our concerned citizens are truly looking more carefully at ways in which the community as a whole can address the growing number of needs in community health. A recent questionnaire distributed to the local Council of Women reported a significant number of members who were interested in initiatives undertaken by other communities to address the problems of community health. In 1993, John C. McGinty Jr., President and CEO of Southeastern Indiana Health Management Incorporated and Columbus Regional Hospital, spearheaded a community-wide effort to identify and address issues of community health in Columbus, Indiana. Mr. McGinty has 24 years of experience in healthcare management with extensive experience in creative products, innovations in service delivery and management. Mr. McGinty has served as at his present position since 1986, and prior to that was CEO and president of Kenosha Memorial Hospital in Kenosha, Wisconsin, and assistant vice president, and I'm hoping I pronounced this right, Waukesha?
Close.
Is that close? Waukesha Memorial Hospital in Waukesha, Wisconsin. Mr. McGinty has a bachelor's degree in economics from Carthage College in Kenosha and a master's degree in hospital administration from Xavier University in Cincinnati. Please help me in welcoming our speaker for this evening, John McGinty.
Thank you for the applause before I've even begun speaking. That's encouraging. And Lee, thank you for the introduction. I am indeed pleased to be here in spite of the fact that we came and got a wonderful dinner at the Irish restaurant, and then we were greeted by hailstorm and rain 10 minutes before we were supposed to start out. But I'm glad you all got here because nobody's going to come out to hear the hospital administrator from Columbus, Indiana. Some of you I know, and I'm pleased. That makes me feel comfortable. It also makes me feel a little bit nervous in that at least people in healthcare know each other. And those people who know me figure they couldn't learn anything new from me. They already learned it. So Jean, Nancy, Sandy, Todd, I appreciate your presence, and I hope I do a good job.
I can turn you back on.
Would that help? Try that. Okay, thank you. Actually, I'm very pleased to hear in the introduction that you've got a diverse community representation sponsoring and attending this evening. That is most important if you're considering embarking on a journey of creating a healthier community for Monroe County or for Bloomington, that pulling together of the entire community is one of the most important elements if you indeed expect success. One faction in the community cannot expect to be able to pull it off on its own. Even a large organization like a hospital or the entire medical community or the business community standing by itself cannot have the impact needed to truly create a community with improved health. So I'm glad you've come from a variety of backgrounds. We are going to tell you our story. And I use the we because I would like to introduce a colleague of mine, Jackie Franz. Jackie, if you'd stand up while I introduce you, or you can just stand up and say hello, and then I'll introduce you a little more fully. Jackie is Vice President at Columbus Regional Hospital, in charge of the foundation, but she also has other duties as assigned. And before she came to work for the hospital, she was passionate about healthy communities. So passionate that she became the chair of the Healthy Community Council, the organization that spawned our action teams and the results that we have produced to date. She was so passionate about that and so effective that she did catch our notice. And now we have her working with the foundation to make sure all those things we've put in place will have perpetual funding and they won't just fall by the wayside. Jackie has an academic background. She was the Associate Director for Academic Affairs at IUPU Columbus for many years and was deeply involved in the community. The good news is you're going to get to hear her for half the presentation, not just listen to me for an hour. And when we're both finished, what we'd like to do is serve your needs, we hope, by our telling you a story of what happened in our experience over the last 5 to 7 years. That might spawn some questions on your part. You have your own story to tell, your own story to create, and you obviously are interested in learning from others. And in fact, what you're doing, we did a few years back. At that time, there weren't that many to learn from, and we're still trying to blaze some new trails where we're doing things that others aren't doing. So we're pleased to be here to tell the story. In fact, others who are involved in healthier community activities are among the most sharing people. When I got an invitation to come and speak here, I didn't even hesitate, and I said yes. I didn't even look at my appointment book. It's something I strongly believe in. It's the only long-term strategy for success for our society, our communities, to focus on health. And we need to do this. So it's the right thing to do. And the people that are involved in it will be happy, as we are happy to be here, to share our journey and our experience with you. We have identified our boundaries of what we're going to be impacting as Bartholomew County. We are a hospital, much like Bloomington Hospital, that serves a regional area. We have a 10-county service area. We have about 300,000 plus in that service area. We felt we could not pull in constituencies in many different communities, many different counties, different political constituencies, and really be effective. We needed to start in a manageable number, and we have a county of about 70,000 people. Columbus is pretty much in the center of the county, and we have said the 70,000 people that live in this county are the people we're going to have a demonstrable impact on the quality of their life. We can count them, we can get database, we can measure results over time. As you'll see when we get into action teams, we know exactly who the people we're trying to impact on. In many respects, this is not really new territory, and something that Jack will be talking about, volunteers in medicine. We are target marketing those people who don't pay. We haven't found many other business examples that can help us target market to that group. So we are learning how to find the ability to target market to the people in our community who can't pay, and that's about 6,000 to 8,000 people. And we've got some good learning in that area. So our focus is Bartholomew County. Our desire is to develop a model, be successful, be able to demonstrate results over time, measurable results, and then have other communities see that in our service area, see the attraction of subscribing to the same kind of healthy community activity. Our journey began 1990. Some of you may have heard of an educational forum called the Estes Park Institute. It's a forum designed for healthcare professionals, community leaders, physicians, and it's to try and project into the future thinking about healthcare. A speaker that has been on the agenda for Estes Park for multiple years is a fellow who is a self-proclaimed futurist called Dr. Leland Kaiser. He comes out of Colorado. And he is one of the first people who spoke about the need to expand, from a healthcare perspective, your definition of what your mission is, what health really means, to think more broadly, think outside of the box, think outside of traditional services. And we had all of our board members over a couple-year time period attend Estes Park Institutes, many of our physicians. We took management staff, we had some community leaders participate, and the one common theme that came back was we have to expand our vision. We had recently changed the hospital's mission statement, from just being an acute care hospital to providing health care services, more than just brick and mortar, more than just an address. This was challenging us to look beyond even health care. And in fact, another faculty member from Estes Park, a healthcare journalist from Chicago, Emily Friedman, a provocateur, challenged us, not so quietly, to look at how we had limited ourselves. And she used such terms as, "You aren't in the healthcare business. I read your mission statement, but I saw what you do. You're in the sick care business. You're great at sickness. And in fact, nobody comes to you until they're sick. You're going to live out your mission to be a healthcare institution. You have to focus on health. You have to change your vision, the boundaries of your vision." A real provocateur. Some of the thoughts at this time, and I'll summarize them as key messages. One is we must reduce the incidence of illness to have a significant reduction in overall health care costs. What is the number one topic in health care today? Costs, right? I don't know that it necessarily should be. Are we paying too little on health care? Is that the concern about cost? No. People are saying we're paying too much. On what basis are we paying too much? What's more important than health? We only spend about 13% of our gross domestic product on health. Why shouldn't we be paying 20%? If health is the most important part of our life, we could be spending much greater amounts. But we somehow, as a society, have said cost is of great concern. And unfortunately, we've taken a short-term focus on cost. What's the cost increase over the last 12 months to the next 12 months? From a societal point of view, we have to take a much longer-term perspective. I just returned from a seminar, and it scared me. It's a presenter from a corporation called AgeWave. Talks about long-term trends. I think some people in the audience here are over 65. Is that right? You claim credit for that? When I reach retirement age, which is not that far away, it's about 20 years, 15 years from now, and then add 5 more years on, the percentage of the population that's over age 65, I think the year 2015, will be twice the percentage of those over age 65 now. Do you think we're going to spend more or less on health care when we have twice the percentage of our population age 65 and older? Anybody got a guess? More, higher, if all things continue as is. There's not going to be a question of will there be demand for sickness services if we stay living the lifestyles we live now with the societal problems, drug abuse, violence, chronic illness. We don't have a hope of reducing the cost per incidence of illness or per admission to a hospital. That we will need to find reductions for the future. The only long-term cost control effort that will be successful is to reduce the incidence of illness, to have healthier people who don't make as many demands on the healthcare system that will have to increase in cost if we don't have a long-term intervention. This is Factors Influencing Health, a summary of research done and presented at the Estes Park Institute. This was back in the early 1990s. Couple of startling things to speaking to a group of hospital administrators, hospital board members, and physicians. Most important factors affecting health. Did you find physicians on the list? Did you find hospitals on the list? No. In rank order, they're not there. You might say, well, that couldn't be. No, the direct correlation between health and one's education and income status is a higher correlation than whether or not you saw your primary care physician in the last 12 months. Housing, clean air, clean water. In most of our communities, these are issues that were addressed in the early 1900s. They had a much more dramatic impact on the health of our society than adding a new cardiac care unit in a hospital. We have to look at how we can improve health, not just apply more resources to fixing bad outcomes of unhealthy lifestyles, which is much of what we do in our sickness business of healthcare. Third, this is a point I made early on, that there isn't one group that can do all this. We've had government certainly take over some responsibilities, public health, tried health planning, health legislation. We have hospitals, we have physicians, we have employers that provide health care coverage. We have chambers of commerce, leagues of women. We have all kinds of people that should be interested in what's most important in our life, and that's our health. And we need to have a dramatic impact, if we're going to have a dramatic impact on the long term, on the health of our communities. We're going to have to bring together all these organizations, work collaboratively with a common vision to be able to have that long-term impact. The question we asked is, how can we best increase the health status of the people we serve in our community, and try and get people out of the boxes of maybe what their full-time jobs are, or what their past experience was, or what the mission statement of their own organization is. A real kickoff for us was 4 years ago. We had a town hall meeting. Town hall meeting for us was calling a gathering of all interested people in Columbus to a center called Donner Center, which is in the center of Columbus. Big park, community center, holds a couple hundred people. We had developed interest among many people, typically somehow associated with the hospital or the medical profession, people who'd been to Estes Park, but we knew we needed that broad diversity of our community, and we sought to enlist, invite, get people to participate in this town hall meeting, and we were very surprised. We had over 200 people participate in a two-day event, and was led, facilitated by Dr. Kaiser, identified some of his vision for the future. People were quickly, directly attracted to that vision. Spent the second day brainstorming in small groups of about 12, on what are the opportunities to answer that question, what we can do to make this community, Columbus, Bartholomew County, a healthier community. And we had over 200 ideas. And we knew when we were done that we weren't going to go out and create 200 initiatives and be successful in all 200. So we went through and let me back up. Captured all that information. We knew with 200 people we were not going to be able to winnow down to the select few that we could have a high chance, a high probability for success, that we'd have resources sufficient to kick off. But we did want to get from that group what their vision would be. Not a Lee Kaiser vision, not a Columbus Regional Hospital vision, but that diverse group together, having spent 2 days together, what was their vision? And we came up with a vision from a group that isn't incorporated, didn't have a charter, just came together because they wanted to make a positive impact on the health of the community. And it's to become a healthy community where each member is valued and shares in the responsibility of making a difference. A lot went into this, the words chosen. One of the most important things that I recall participating and hearing others participate is that this is not a one-way street. Not just a couple hundred people who wanted to do good for others and do it to others, but they wanted it to be a two-way street. And every person is valued, those providing support to others as well as those receiving the support. whatever services, whatever support we're going to provide, we're going to do it with people, not to people or for people. And then in fact, the people receiving support or services also have responsibility. They may be the one 5 years later in the reverse position. Expanded on that vision statement and identified that some things that may not sound real healthcare-like, but came out of people's answer to how do we make this a healthier community. Promoting a sense of personal and community responsibility, that individual responsibility translated into, I'm my brother's keeper. That's why I'm participating in this community planning. Improving access to primary care, and you'll see this is one where we've been able to move from vision, priorities, into planning, development, and action, and now have some demonstrable success. Placing greater emphasis on disease prevention and health promotion gets directly back to that issue of if we're going to have an impact in the long term on costs, we have to have less disease and less accident, less need for intervention. Wanted to build on neighborhoods. This was a strong theme in the town hall meetings that I think was a recognition of the sense of loss of neighborhood. The neighborhood where people in smaller subsets of the community all knew each other, cared for each other, and received support from each other. And instead of having a centralized service for 70,000 people, we were going to be looking at ways to reach out in much smaller groups of being able to touch people's lives. And we've been able with some success to do that. And we have plans for future activities there. Next one is a long-term one. I think we have been doing that by our presence in the community, and that's trying to create cultural norms that support healthy lifestyles at home, at schools, at workplaces. Things like encouraging the absence of smoke anywhere publicly. Encouraging in our community the corner right by the high school, which is called Cancer Corner, where all the kids go out and smoke, and the police cars drive right by, even though it's a violation of the law to smoke. And for our kids in high school to understand the cultural norm is we accept smoking. Yeah, it's illegal, but the police just drive by and it's accepted. To change that and say, if you're going to smoke at the corner, it's illegal, and the police are going to ticket you. Big change. It sounds so simple. We're still not there yet. It's taken us about 3 years to get there, and we have some reluctant police officers. That'd be one example. I have to share this. We did go down to the Irish restaurant on the square. Yeah, the Irish Lion. I enjoy when I'm traveling discovering what the cultural norm of the community I'm going in is, and I usually can determine that by their smoking policy. I remember the first time I tested this out, it was in San Luis Obispo, California, and I called to make a reservation at a restaurant, and I said, I'd like a no smoking table, please. And she said, well, they all are, and I congratulated them for their no smoking policy, and she says, it's the law. And I knew they had made a commitment. When I walked into the Irish Lion, I knew they hadn't made a commitment. They had a big, bold, black and white sign saying, 0% of the seats are non-smoking. Don't even ask. Now, I hope that isn't too much of an indictment. It's a landmark restaurant, and I'm glad I went there. I asked to go there because I heard so much about it. I won't go there again, though. I don't like smoking environments. My life is almost smoke-free, and when I'm confronted with smoke, I get away. That's a cultural norm that's becoming more common in our community, and that's one of our goals. Positive opportunities for youth development. Clearly identified from a group talking about health. Why would they talk about youth development? Isn't that like the YMCA or the Youth Foundation or Biddy basketball? No, it's positive youth development because kids are learning bad lifestyle habits at a very early age, and they're not going to be able to break out of them. And we have a chance with them. You know, some of us who have had 47 years of bad habits, it's much harder to break than preventing somebody from getting that bad habit. Again, our emphasis is we were going to have to collaborate together. There was no one organization, no one person that was going to be able to bite off this vision bite off these priorities have any reason for believing they'd have a chance of success by themselves. We also knew at that time, and this might be true in your community as well, that this couldn't be hospital or provider dominated. It couldn't just be a group of nurses or a group of physicians or the hospital organization, that wasn't enough. And in fact, we wanted to be the minority because we wanted to enlist the support of all segments of the community. So from this point on, from this town hall meeting, we were very conscious about making sure that, as passionate as some of the healthcare providers might be, that what we did, the healthcare providers were in a minority in participation, in committee meetings, in the formation of the council, and I think that was an important element for us. It could have been perceived that this is just a hospital project, we don't have to participate, they'll just do it. And it won't be successful. It wouldn't have been successful for us in that way. After we had the two-day town hall meeting, we had all these ideas, a couple hundred of them. Each of them could have resulted in an action team and some money and resources to go out and do what was created out of that brainstorming session. And we knew we couldn't do that. We decided it would be the first task of the Healthy Community Council that was going to be composed of those people who had demonstrated by their participation in the town hall meeting, the planning for it, that we would form a council, and out of all those ideas, we would prioritize what are the first initiatives that we would attempt to tackle. We wanted a broad, diverse group, and here, with stars by their titles, are the groups we got to participate. We got business leaders. In our case, we had business leaders from small and large businesses, including Cummins, the largest business in town. Got the Chamber of Commerce, Steve Helmick, the executive who heads up our Chamber of Commerce. Got the clergy involved. We had the superintendent of schools participate, hospital participate. I directly participated in the council. Got local government involved, city government. We now have county government as well. Got the media involved, the publisher of our newspaper. We had nurses who worked in the hospital, nurses who worked in public health. We got physicians involved. We had a strong support from our physician community. Public health is very important. And United Way. In fact, our recently appointed United Way director has joined the Healthy Community Council. This group, following the town hall meeting, looked at all of our opportunities and had some objectives to be met before we made any decisions. And we came up with a criteria list of, one, how we were going to operate and how we were going to make decisions. And one was that we were going to be collaborative, both in our decision-making process about what's important, what action teams will we form, where will we provide supporting resources, but we also wanted to be collaborative in whatever the outcome of those action teams were. We didn't want to be seen as the new initiative in town who's going to take over anybody else's turf. We wanted to find people who were already doing these things, maybe fragmented, maybe haphazard, maybe without any measurement tools to support them, and bring them together. We've got some examples of how we did that. We've had public health working together with the hospital, with the schools. We've had shared staff people between agencies, between the hospital and Children's Inc. We really wanted to work collaboratively. We wanted community ownership. We wanted not only participation, but we wanted a sense of ownership. We wanted them to feel like they had a stake in what was being done. And one of our examples where we had a real need for dollars is the Volunteers in Medicine Clinic. Jackie will be explaining in more detail. That could have been done with financial support from one source. Instead, we wanted, and we secured, much more financial resources by asking from multiple sources. Inclusive and broad-based, I think I'd be redundant if I went at that again. We recognized early on, in fact, at the time we were initiating our action teams, that we also needed to have benchmarking data and set measurement tools in place. There had been enough experience from others who had started out in small ways with local initiatives, and they wanted to do something, and they wanted to put helmets on kids' heads to prevent traumatic head injury when they fell off their bicycle. And it was a one-shot deal for 1 year. They had no follow-up. They knew it was a good idea, but 3 years later you didn't know, do we have more ER visits from kids riding bicycles or fewer ER visits? Nobody was tracking it. So you did an intervention and you had no measurement to actually demonstrate whether the intervention had its desired impact, or if it did have its desired impact, that you were holding the gains. So measurement was recognized by us as very important, and data. Recognized a need for a long-term commitment. We didn't want to have a program of the month or a program of the year. We wanted to have the ability to have impact that we'd be able to measure over time, multiple years. This became important when we looked at the resources needed and the funding needed. It's one thing to talk about some seed money for pilot programs to get something started. It's another to recognize you're going to be meeting the expectations of 6,000 to 8,000 people who haven't received care, and you're going to do it with funding for 1 year. What are you going to do the second year when those same people have need for care? So we had a need for long-term commitment to funding. Continuous learning. We knew from our journey that we had a lot to learn. We needed to change our vision, expand our own thinking, and that while we were in some new territory and on the cutting edge, that we still needed to be a continuously learning organization. And in fact, we were probably going to learn from some of our missteps and our failures. And we've proven that true. And to be positive and motivated, that this is exciting work. It should be work that people have fun with. It relies heavily on volunteers. And it's one of the most positive experiences I've ever been involved in my life. And I hope other people can say the same thing. You make a difference in a way that just is very rewarding. What we came up with, we wanted to start, not just pick one program. We didn't want to have the community that had gotten so excited about healthier communities see that we translated into, we were going to put one program as the emphasis for the next 3 years, and that it was very narrow targeted program, maybe just for little kids, or a program for immunization. We wanted a program that at least potentially touched the lives of almost everybody in the community, or a member of their family, or a personal interest they had. So that was one of our criteria. Another one of our criteria at the time of selection is we felt we needed something that would have a short-term gain that the community could see. If we only picked some action teams that had a generation to demonstrate any positive results, we didn't think we'd keep that positive attitude, enthusiasm, and the group of volunteers together. So we wanted some short-term gains possible. We also wanted to play to the interests of the greatest number of people. And when I said we had hundreds of ideas presented in brainstorming, we collected them together, and although they might have been stated a little bit differently by each individual doing the brainstorming, they collected themselves together into groups of interest. And the first one was access to primary care. We had a problem, we still have a problem, with lack of easy availability to primary care. And this is not just for the people that are candidates for volunteers in medicine, it's also for people who have the financial means to pay for primary care. We also, in this process, expanded what we thought was the need for access to primary care, which some of us in the healthcare field thought meant, oh, you have to go to a primary care physician. Primary care means family practice, internal medicine, pediatrics. I learned that in school. Primary care doesn't mean that. 80% of care is provided by yourself. You monitor your own health conditions. You might take aspirin. You might sleep a little more. You might take other over-the-counter medicines. We can do a whole lot in self-care with people who are made more knowledgeable, have resources available to them and reduce the need for access to the most specialized primary caregiver, not yourself, but a physician. So we continuously learning in this process. We just added /self-care. We were originally going to just say access to primary care. We added self-care, and that's proven to be an important definitional change. Second action team was on immunization. Started out from a lot of the comments and brainstorming for children. But there are immunizations for adults that can be just as important for adults as for children. And rather than limit ourselves to one age category, again, we wanted to broaden the impact of our initiatives. So we have immunization for children and adults. And this one, we think we hit about everybody. All of us were born, and hopefully all of us will make adulthood. Next one was, in fact, one we struggled with. Whoops, excuse me, I didn't want to go there. Tobacco awareness. I've already spoken about it because I'm personally passionate about this issue. But I recognized, and others in the council recognized, this is a politically sensitive one. I understand in your community you've gone through the debate and there's now an ordinance, and for every new restaurant that seeks a permit, they have to provide a smoke-free section. Is that right? You didn't go far enough to say they have to be smoke-free. They just have to provide smoke-free? Okay, and existing restaurants have to post a sign that I saw. We don't have any. Ha ha. That can be a tough one. It affects people whose livelihood depends on customers. Maybe 20% of them smoke. That's certainly a sensitive issue in our community as well. Unfortunately, we have a very high percentage of the people in Bartholomew County that smoke. In fact, our entire state ranks second only to Kentucky in the percentage of population that smokes. Not a real healthy indicator for our state. Building more hospitals won't make us healthier. Turning out more fellows in pulmonology won't help. Not smoking will help. We can have an impact there. But we were concerned about picking not a political, positive, sure bet winner. We haven't found anybody yet that's against immunization. That was pretty easy to get support on. There are people who are pushing back on our action team in tobacco awareness. And I think we're in for future rocky roads. But we didn't feel we could back away from that one. I think as a public health menace, that's almost up there, number one. Some might argue about drugs. Tobacco is the pathway to other drugs. So we couldn't walk away from that one, and we didn't. Final one is breast health. Single leading cause of cancer in women. It's proven to be able to be early detected and highly successful in treatment. And of course, the success of treatment increases in probability with early detection. Mammography, early detection. We wanted to see that 100% of the females at risk had a mammogram in our county. That's an example of, you can take from 70,000, out of 70,000, there are probably about 38,000 that are female. Take age 40 and over, and you can get down to maybe about 18,000, 19,000, and you've got a workable number. You can find out how many of those already have had an annual mammogram and how many haven't. When you figure that out, you then have to figure out a way, how do you get those who haven't in? That one has also been a very positive one. First action team, primary care, self-care, developed its own mission statement. And that's to provide access to primary care, to remove barriers so that every resident of our county is known and cared for by a primary care provider, and they work together to increase the appropriate use of self-care. Broadened in their mission statement from what the Healthy Community Council chartered them to be. Took another step and breadth of what primary care, self-care could and should be. Came up with 4 separate working groups to support that mission. One was Volunteers in Medicine, a program you'll be hearing more about. It's now got a physical presence in our community. And Volunteers in Medicine was an idea that came at a time while we were just forming our action team. Also came from our experience with Estes Park. One of the Estes Park Institutes is taking place at Hilton Head Island, does so every year. In fact, Jackie's husband, Sherm France, our Vice President of Medical Affairs, was attending. Met a fellow named Jack McConnell, a physician who retired in Hilton Head, and was appalled to see that the relatively wealthy people like himself who had retirement places on Hilton Head got excellent health care. But all the people who provided services who lived on Hilton Head in not quite the same economic prosperity that the retirees lived in did not have available access to health care. And he personally took it as his action team that he was going to do something about it. And he did. And he's been well recognized. He's been on TV identifying what he did. He changed legislation in the state to eliminate the need for malpractice insurance. He got all the retired physicians in Hilton Head, not all of them, many of them, to agree to volunteer their time if he would build a clinic. He then went and got businesses and others to contribute money to build the clinic and started what he called the Volunteers in Medicine Clinic. We used that model. We in fact brought Jack McConnell to Columbus to talk to all the interested physicians we could find in Columbus. We have some very good physicians who are well motivated and volunteering. We had one slight difference. We didn't have quite as many golf courses in Columbus and not the supply of retired physicians. Unfortunately, our physicians choose to go to Hilton Head when they retire. So we didn't have the ready supply of retired physicians to be volunteers, but we've got 30 or more actively practicing physicians who volunteer their time. They're that committed. So we took that model, translated it into what we could do in Columbus. Self-care promotion, that's the recognition that your own decisions about your health can be very important. They have educational activities, and in fact, in our Volunteers in Medicine Clinic, we have a self-care room, we've got a computer, a lot of resources for people. Next one is one we haven't moved ahead as fast as we would have liked to, and that's school and church-based health programs. Great opportunity there. We know from our networking with other communities that there are parish nurse programs, school nurse programs, very effective. If you think about it, in most communities, the construction of schools is based upon neighborhoods, population. If there's a distribution channel for whatever it is in healthcare you'd like, you've got schools already there. In many respects, churches are the same way. And unfortunately, even the clergy will say, the most underutilized facilities you have in your community are churches. So there's great potential in school and church-based programs. Another one is family mentoring, and that's a program that we began early on, in fact, almost the time of the creation of the council, where we have collaborative efforts between agencies in developing that mentoring program. We talked about Volunteers in Medicine. This actually moved from being an action team and then a subcommittee to the commitment to a Volunteers in Medicine clinic, the creation of a separate board of directors. That board has ongoing responsibility for the continued operation of the clinic. And this is what they came up with in their initial planning. It's a free health care clinic for Bartholomew County residents who meet income guidelines and have no health insurance. And this was translated into a market of 6,000 to 8,000 people in our county who fit that definition. The eligibility requirements, you had to be a resident of Bartholomew County, household income 60% or below the median income for Bartholomew County residents. You had to be uninsured or underinsured. And services we provide are identified, and at this point I think I've gone one slide too many for Jackie, and I wanted to reintroduce Jackie Franz and have her give more of the specifics about volunteers in medicine, the very visible result of an action team, and then also go through the other action teams and what they're presently doing.
I'm without a pocket, so I'll just hold it here. Can you hear me okay?
Got a pocket?
No, it's not. I'll just hold it. You can hear me okay? All right. I think John has covered volunteers in medicine really very well. We are focusing on acute primary care and annual physicals, but we also have chronic care management. We're getting some clinics together now where I think it's not surprising. We see a lot of patients there, high blood pressure, diabetes, that sort of thing. And so we're starting to get the chronic care management. We do a lot of sports physicals for children. The schools tell us that that's a very important function. And we do a lot of medication assistance. In fact, if I had to say that I have one concern that would keep me up at night worrying about volunteers in medicine, that's to keep those costs from running away. But we have some strategies that we're putting in place that we think will help us meet that. And then finally, the self-care resources, and John alluded to that. We do have a self-care resource room in which we have InfoTrek. Are you familiar with that? It's a CD-ROM product that just has a wealth of information. If you have someone who is newly diagnosed with diabetes, for example, you could bring that person in, set them down at the computer, even if they've never had experience at a computer before. If you have a volunteer who's comfortable doing that, what we find is we have difficulty extracting them from the room because it's such an empowering experience. But that particular CD-ROM product will take them through what the best treatment is. Then we also have access to the internet, and we can directly hook those patients with other groups who may have a similar diagnosis of diabetes, and they can talk to people all over the United States in terms of what's the course of your illness, what is your regimen. Just a very powerful tool for helping people feel in control and responsible. I guess I can't change it with my... One of the things that we are really committed to in all of our action teams is keeping good statistics. And this is another thing that we're constantly learning about. I think one of the things that we would have done differently is we would have done a community health assessment before we even did anything else. That's a key learning that I can share with you. This data is just for the first 3 months that the clinic was open, but during that time, and understand this was primarily word of mouth, we did roll in, prior to the clinic's opening, we did have a healthcare and referral clinic that was open 2 or 3 days a week through the county health department. And that was one of the strong collaborative efforts. The county health department really worked and is still part of the board of Volunteers in Medicine, and they in essence rolled that service into Volunteers in Medicine. In fact, the one full-time nurse employee of the hospital made that transition from public health, not the hospital, Volunteers in Medicine. She went from public health to be an employee of Volunteers in Medicine. So I think that too has been a key in the success of having so many people aware of and using the facility so early. But in the first 3 months, there were over 1,000 patient visits, and we are expecting probably about 4,000 patients by the end of this year. So we will be meeting at least half, if not 2/3 of the need that was identified earlier. The 10 most common diagnoses, I don't know if this is a surprise to you, dental care. We have 18 dentists who volunteer their time, and we are doing simply extractions at this point. But we're doing a lot of education in terms of teaching people, particularly children, good dental hygiene. Living in Indiana, you're not surprised to see sinus infections up there, are you? And ear infections, hypertension, acute bronchitis, seeing, I think the number of depressions is continuing to increase, and I've already mentioned diabetes. So there's a lot of a mixture of both acute and chronic diseases that they're seeing. The volunteer support has frankly been overwhelming. When you think of getting 30 busy physicians to regularly volunteer their time at the clinic, it's really a humbling experience. Probably even more dramatic than the physician volunteers have been the nursing volunteers. We have 6 nurse practitioners who volunteer regularly and more than 80 nurses who are volunteering in the clinic. We currently have also a group of dedicated community volunteers, and I want to stress that these community volunteers are every bit as important as the medical volunteers, the professional volunteers, because they are really the people who set the tone, who make the patients feel welcome, who help them to feel empowered. They work as greeters, receptionists, they're schedulers, and they do the screeners. The only thing we ask a patient when they walk in the door is, are you a resident of Bartholomew County? If the answer is yes, we see them. Then on the back end of that first visit, someone does an intake assessment about they need to produce something that, a light bill or something that shows they're a county resident. They need a stub from a paycheck or something to verify their income. But the thought is we want to treat everyone initially who comes in the door, and then if we find out during that screening period that they're not an appropriate use of the clinic, we can at least give them alternatives. We try to give at least 2 other possibilities for them to meet their healthcare needs. I need to back up just a moment when I mention the 30 physicians who volunteer regularly at the clinic. There are another 50 or so physicians who take volunteer referrals. If you get someone who needs surgery, there are a group of general surgeons who take referrals. And the hospital provides all of the services if they would have to have surgery. They also provide x-ray, and we have very limited lab facilities, so the hospital also provides the laboratory needs. Here, I guess I was ahead of myself. Here is the slide about the referrals to the physician specialists and to the dentists. A very important part of what we are about is making sure that we're also measuring the satisfaction levels on the part of the people who are coming to the clinic, both the people who are volunteering there and the people that we are serving. So with each visit, they have a simple questionnaire that the patient answers, and it's a scale of 1 to 5, 5 being very satisfied and 1 being not satisfied at all. And I think you can see by this slide that we have a pretty enviable satisfaction level on the part of the clients that we're serving. In the heart of our Volunteers in Medicine clinic, on the wall in very big lettering is the vision statement for Volunteers in Medicine. And it is that we welcome those in need to come without fear and invite those who serve to come without pride, so that in their meeting, or so that their meeting may bring healing and hope to both. And this was developed by patients who use the clinic and by the board of directors of the clinic. The overriding theme that we heard at the time we were doing focus groups to determine the need was, we want to be treated with dignity and respect. That it's hard to feel good about yourself, it's hard to feel healthy if you are not feeling like a whole person because of the way you are being met. Moving on to, this is one of our lessons learned, wasn't it, John? We thought that immunization would be a snap, we'd be in there at the end of the first year, we'd say, we're successful, look at what we've done, and get on with it. Well, this has been one of our more challenging action teams, and it's just now really coming together in a very exciting way. We were a kind of a pilot program for the State Board of Health in their immunization registry. We just finally went live with it, and very soon we will be able to link all of the physicians' offices, public health, the hospital, so that the barrier that's been there is parents show up to get their children immunized, but they don't have the papers, or they've lost them, or they don't remember, and they're sent home and they're discouraged. The other part of that is that we just found out that the percentage of older adults in Bartholomew County who are immunized for pneumonia is double the state average, and the State Department of Public Health thinks that's directly because of the money that's been made available through the hospital and the foundation for free immunization for adults, the older adult population in the county. Each action team has a set of strategies. They have a very well-planned work plan, and they have measurable, they have benchmarked, and we have objectives that we think are measurable. And our strategies are the immunization registry, education and awareness activities, super shot events. These are highly publicized through public health. And we just last week had a community birthday party in which every 2-year-old in the county who had appropriate immunizations came together at City Park, and there was cake and games and balloons, and it was a wonderful time, and an opportunity for children to learn very, very young the importance and the joy of being responsible for your health. The data on immunization is, I think, kind of shocking. 2-year-olds in Bartholomew County, barely half of them are immunized at the level that they should be. Our goal for 98 is to have 80%, and then by the end of the century to have 90%. The tobacco awareness that John talked about, it's simply to decrease the use of tobacco in Bartholomew County, and we really have a 5-pronged approach now. We do have the enforcement of existing laws, and we have, we're working very closely with the city police department. We have a couple of policemen who are on the action team and who are trying to help us encourage police to follow up and include an education component. That's what we're stuck on. We think just arresting kids and having them pay a fine is not going to do it. They need to be required to attend some kind of smoke stoppers clinic. We have a high school heroes program. That's where we pair every middle school, no, 5th and 6th grade student, because we found that's the age where you really have to start targeting. That's the age, believe it or not, that a lot of kids start smoking. And pair them with a high school student, and the high school student has a little styrofoam lung that they smoke smokes a cigarette, and the children look at how gross that is, and they have Mr. Grossmouth, and just and plus it's a peer that they're looking up to that can have probably, I think, more influence than maybe you or I could have. We have a visit by Rick Binder. I don't know if you've heard about him. He kind of looks like the Marlboro Man. He's from, I think, Montana, and he lost half his jaw to chew, and he is a very effective, emotional, graphic speaker who I think really reaches young people. John mentioned that we're working on smoke-free policies, and we have just instituted our first Smoke Stoppers Clinic at Columbus North High School. It was requested by a group of kids there who smoke, who don't want to. We've had wonderful cooperation from the school corporation. In fact, the assistant superintendent is the chair of this particular action team, and they've set it up so these kids can go to the clinic while they're in school, and the first session meets the first period, then the next week it's the second period, so that they can go through a 6 weeks clinic on school time with only missing one class period per class, which is pretty terrific, and they have total support of all the teachers in that as well. We were shocked at the statistics that Indiana University gathered for us in terms of the level of smoking in Bartholomew County. I hope it's not as bad here as it is in Columbus. The young people that I'm connected to say they think this figure is low. They think it's more than 40% of the kids who smoke. But currently, the rate of cigarette smoking among high school seniors, and this is, they say they use cigarettes regularly, is nearly 40%. The other shocking statistic is the rate of smokeless tobacco, or what the kids call chew, at 15%. This is increasing among young women. Girls are choosing to use smokeless tobacco in higher numbers. They've told us, we have young people who smoke on the action team, and one of the reasons they tell us is that it's becoming increasingly uncomfortable to smoke, and they use it for weight control. So we have a lot of work to do on self-image as women, I think. The Breast Health Action Team, this is the wonderful example about opening your action teams, or whatever you choose, to a broader community support. This was originally brought to us by physicians in our cancer center, saying the number of the incidence of breast cancer in Bartholomew County women is alarming, and we really want to do something about it. And so we called it the Mammography Task Force, or Action Team. And we got some women from the community, not in the healthcare field, and said, why on earth are you calling this mammography? This is much broader than mammography. This is breast health. And so from that, we broadened it to that 3-part breast health plan, the breast self-exam, the breast clinical exam, and the screening mammography. There's some exciting and innovative things they're doing. They're training every person who works in a beauty salon in Bartholomew County is being invited to get trained on how to talk to your clients about breast health. Just getting them comfortable to talk about it. We have decals that they're putting on all their mirrors that say, "I'm a supporter of breast health." And I think it's going to be exciting to see. We have some measurement built into that. We have a calendar that's going to be distributed on Mother's Day. It's this 18-month calendar. Each month features a woman or women from the community who talk about the importance of breast health. Many of these are breast health survivors, or their mothers or daughters of people who have died or are breast health survivors. And then we have local breast care guidelines, and we are providing low-cost or no-cost mammographies. We've had difficulty measuring, but we have been able to get information from Indianapolis and locally that we know that there are about 5,000 women age 40 and over who are not currently getting mammography. So, and we think about half of these are women whose insurance won't cover it or for whom finances would be a barrier. So the hospital has committed $50,000 to the mammography portion of this. Yes, it's time to talk about the financial support. Originally, all of the support for the initiatives came from Columbus Regional Hospital. They paid for Lee Kaiser's visit. They underwrote the cost of those initial town hall meetings, and they also have continued to support the staff. We have one full-time staff person who is dedicated to not only the coordination of all these 7 action teams, but that person has also been very visible in the community, helping other community groups, really helping to teach systems thinking, helping all of us to learn to look at the community as a system and to work on issues of trust and collaboration. In addition to that, we have 2 part-time paid staff who are helping with the immunization and the breast health and what's the other one? Oh, Caring Parents, the mentoring program. In addition to that, the Board of Trustees of the hospital made a commitment to commit $250,000 a year to the hospital foundation as a matching grant, if you will, to anyone who gave any monies that were donated to the foundation would be matched up to $250,000. The $250,000 that the hospital Board of Trustees has committed goes into an endowment. 50% of the earnings on that must go to the Healthy Communities Initiative. But they will match funds that are dedicated to cancer, or you don't have to make your gift specifically to the Healthy Communities. The foundation has assumed the responsibility for being the primary, we have the responsibility for funding all of the Healthy Communities initiatives. We're taking that on by getting commitments from businesses, from churches, from individuals, and from local foundations. That foundation support, we went to all the local foundations and said, we need seed money for 3 years to help us see these initiatives through the first 3 years. The hospital foundation during that time will conduct a capital campaign. We will try to raise $3 million to bring the endowment up to a $5 million endowment. That, coupled with a regular annual appeal and a special event, we feel that we'll be able to sustain the initiatives if we are successful in that venture. And clearly, Volunteers in Medicine is one of the major appeals to the broader community. So we encourage people to designate directly to the Healthy Community Initiative Fund, or they can designate specifically for Volunteers in Medicine. And then we have an annual allocations that when we decide how we will distribute the money. I mentioned that we have a goal of a $5 million endowment, and this next month we will be initiating a capital campaign for a $3 million capital campaign. I'm going to share with you what I feel strongly are the keys to success. First of all, it wouldn't have happened without real commitment on the part of the hospital, particularly the trustees and the senior management. I think everyone connected with the initiative feels strongly about this, and yet at the same time, it only works if you give it away, and the hospital has never hit anybody over the head with their generosity or their support. It's been very much in the a quiet servant leadership approach. A real commitment to the guiding principles that John went over before, and I don't want for a minute to make you think they're easy. Collaboration is one of the hardest things to do. Trust building is earned. It doesn't just automatically happen. We make 2 steps forward and sometimes 1 step backward, but we're getting better at it. Dr. Leland Kaiser's vision has been instrumental in, we bring him back every October for 2 days. He meets with broad constituency of the community, and people are challenged and empowered and uplifted after hearing his compelling message. The other secret, I think, is dedicated staff support. Volunteers can't do it all. You do have to have some staff who are there coordinating it. The person who was our full-time staff went through the Healthcare Forum fellowship program, and the learnings and the networking that she gleaned from that were also, I think, highly instrumental in our success. We're taking how many, John, to the Healthy? 14 people to the Healthy Communities Summit. Most of us are leaving this Friday, and that is also a key education and inspirational. Challenging, not always comfortable, kind of there are the Emily Friedmans there who kind of push you out of your comfortable rut, but I think that's also key. And then a well-defined communication plan. We kind of know from step to step what we want. And one of the things I didn't put on there that we probably should have, and that was a commitment from the Healthy Communities Council from the onset to say, this is a long-term commitment. We want at 3 to 5 years from you before you say yes. and I probably shouldn't say this because I'll jinx this, won't I, John? But we're batting 1,000. We have never asked anyone to join the council who has not agreed to, and their attendance is phenomenal. We meet from at 6:45 in the morning until 9 o'clock every other month on a Thursday morning, and we have just virtually 100% attendance. So these are busy, committed people, and they're not all morning people either. So. Okay, and the lessons learned were select one action team that can have some quick, meaningful success. I shared with you that we thought we were going to get that in immunization, and we didn't. We never dreamed it would be volunteers in medicine. That was kind of a surprise. Strong leadership and staff support. Conduct a community health assessment early in the process, which we did not do. We did one this past October, and it was very confirming on a lot of different fronts, but it would have been nice to have had that data initially. And then finally, don't be afraid to think big. To use the volunteers in medicine as an example, to think that you could set up a clinic that would serve 6,000 to 8,000 people and do it with volunteer physicians who are busy in their own practices. I just think if people are inspired, and it does really appeal to that basic part of I think every physician and nurse, and kind of why they went into medicine in the first place. This is a joyful way to reconnect with that feeling. The next steps for our Healthy Communities initiative is to integrate more closely with the economic development. We know all the data shows that it's education and income that make the biggest difference in health. Our phenomenally busy superintendent of schools is so committed to this that he's agreed to be our Healthcare Forum Fellow, and he's committed to a year of intensive education. But I think it's the payoff for our school system and for our community is going to be dramatic. We have strong support from economic development, and we'll be working much more closely with them and with area employers. And our real focus for the next year is going to be how do we educate ourselves as a community to think of ourselves as a system, with every opportunity to look at how are we linked, where are the natural parts for connection rather than how are we different and separate. And finally, I'm going to close with a quote from the president of the American Hospital Association, when in essence what he says is that every medical solution really will be found through social work and public advocacy, and that's what we're all about. And hope I haven't talked too long, but John and I will certainly be happy to take any questions.
Thanks for your attention and interest. I hope you have a vision of writing your own story for Bloomington. I hope we have given you some glimpse of one community that's made some progress, had some success, took a couple steps backward here and there, and learned, and we're continuously learning. Could we respond